Caption close Minneapolis, AP, TC Bell knows what life is like without health insurance after growing up with a mother who cobbled together care from a public health clinic, emergency room visits and off-the-books visits to a doctor they knew. That memory makes Bell, of Denver, grateful for the coverage his two daughters have now under the Children's Health Insurance Program and concerned about its uncertain future in Congress. "There's an incredible security that I have with CHIP," said Bell, 30, who has gone back to community college to reboot his life after working a series of low-paying jobs. "If my daughters get sick or seriously injured, we can take them to their doctor, rather than when I was growing and had to go through the emergency room. We always kept our fingers crossed back then." CHIP provides low-cost coverage to children in families that earn too much to qualify for Medicaid. But it has become caught up in a political stalemate over how to fund it. Congress failed to reauthorize the program before it expired in September. Several states are expected to deplete their remaining funds for it by next month. The uncertainty has left states scrambling and causing worries for families that depend on the program. "The fact that they want to play politics with our kids' health care is appalling," Bell said. "All we're asking for is an investment, not a handout." CHIP was built for the working class. Each state designs its own version of CHIP with different rules and coverage, so each faces a somewhat different situation. But Arizona, California, Colorado, Minnesota, Ohio, Oregon, and the District of Columbia are among the first expected to exhaust their CHIP allotments. "We're seeing every month more and more states running out of their funding for their CHIP programs, so it's becoming more of a national issue," said Emily Piper, Minnesota's Human Services Commissioner. Fresh federal money for CHIP, which was created in 1997, dried up October. One legislation to extend the program for 5 more years passed the House earlier this month. However, majority Republicans decided to pay for it partly by cutting a public health program created under former President Barack Obama's health care law, and by raising Medicare premiums on upper-income recipients. Those provisions make the bill less palatable in the Senate. Senators have agreed on a bill extending the program for 5 more years but remain divided over how to pay for it. Congress was really focused this summer on repealing and replacing the Affordable Care Act, and there wasn't a lot of oxygen left in the room to talk about just about anything else in health and human services, Piper said. Now Congress has turned its attention to its tax bill, she added. "The CHIP program has been a bipartisan program for a really long time, and it's more to do with other priorities than, I think, to do with people not wanting to fund CHIP. An eventual fix is expected to be part of a huge year-end spending bill aimed at preventing a federal government shutdown, but that's not guaranteed. Now, with funds running out, states are struggling with what to tell families who rely on CHIP," said Samantha Artiga, an analyst with the Kaiser Family Foundation.